Good morning and welcome to Monday Morning Medicare. My name is Will Butler and I am an insurance agent. I specialize in Medicare supplement insurance along with Medicare Advantage plans. So today's topic is original Medicare. So we're going to go over when and how to get enrolled, what's actually covered on the original Medicare, and then also what are your out-of-pocket costs. All right, so when and how are you going to be enrolled into Original Medicare Part A and Part B? Well, the when is you have a 7-month window, and it's called your initial enrollment period. It's going to begin 3 months before your 65th birthday. It's going to last the month of your 65th birthday and then go all the way to 3 months past your 65th birthday for a total of 7 months. All right. Now, for Part A, it's pretty simple. Most of you will be automatically enrolled by the government on the first day of your birth month. So, for example, if your birthday is on March the 17th, then on March 1st, right before your 65th birthday, you will be enrolled into Medicare Part A automatically by the government. Now, for Part B, it's a little bit different, and it depends on whether or not you've been collecting Social Security benefits. So if you have been collecting Social Security benefits for 4 months or longer leading into your 65th birthday, then you will automatically be enrolled into Part B as well. So your Part A and Part B will all automatically be done by the government if you've been collecting Social Security benefits longer than 4 months leading into your 65th birthday. Now, if you're not collecting Social Security benefits, it's still simple, but there's three options. You can call the Social Security office and the 1-800 number is there. You can go up there to the Social Security office yourself, or you can go to this website that I have below in blue. You can just hover over it now and click on it if you'd like, or just come back to this video later when you need to do that. All right, so now let's talk about coverage. So what is Original Medicare going to cover? So Part A is going to cover most of your inpatient services. So your skilled nursing facilities, your inpatient drugs, your hospital meals, okay, inpatient services. Now Part B is going to be more of your outpatient services. That's your doctor visits, lab tests, urgent care, okay, things like that. Um, Original Medicare is going to cover 80% of these costs for you. All right, so let's talk about your out-of-pocket costs when it comes to Part A and Part B of Original Medicare. So Part A, remember, that's your inpatient hospital services. So that's when you're in the hospital. Now, there is a $1,408 deductible when you go to the hospital, but it's per 60-day benefit period. And I put that in red because I really want you to understand what that means. Um, you could actually be paying towards this deductible and then have to start over again if you go to the hospital, a few times throughout the year. So, for example, if you go to the hospital and you're there for, any time less than 60 days, and you paid the full deductible, or you paid half of it, it doesn't matter. Whatever you paid towards it, if you go back to the hospital, say 3 months later, then you're going to be responsible for that deductible all over again. Okay. Now, if you're in the hospital for one stay and it's longer than 60 days, then the price per day is going to go up after day 60, as you can see here on the slide. Now, for Part B, your outpatient services, that's different. That's an annual deductible. And that annual deductible, as you can see, is $198. Now, with Part B, there's also a premium. So I didn't have that on here, but I want you to know that, for 2020, that amount is $144.60. And that's going to be taken right out of your Social Security unless you have it set up to come out a different way. And then there's no annual or lifetime out-of-pocket max. All right, so next week on Monday Morning Medicare, we're going to talk about Part D prescription drug coverage. We're going to go over costs, when to enroll and why it's important to enroll during your initial enrollment period. And if you've made it this far, I also want to thank you for hanging in there with me. And if you have any questions regarding, this video or anything regarding Medicare, then please just never hesitate to give me a call. You can shoot me an email or message me on Facebook, whatever's comfortable for you. Have a great day, and we'll see you next week.